Let's take a look at two recent studies published on the use of medium chain triglycerides for cognitive function. I learned of these two articles from the newsletter from Dr. Anthony Gustin, who is a chiropractor behind the company Perfect Keto, which makes products and provides a lot of great education on their website. Products like ketogenic protein bars and snacks. So this first article here was published in the Journal of Nutrition this month, and they looked at the use of medium chain triglycerides in elderly adults. They took a total of 64 nursing home residents, and for 3 months, they gave them either supplements that had medium chain triglycerides in them, like MCT oil, or that had other fats that were not MCT oils. And they monitored their cognition. They checked them, as they said here, at baseline, and then 1.5 and 3 months after they started the MCT oil, and then 1.5 months after they had stopped it. They did the mini mental state exam to objectively quantify their mental status, and they found an improvement in the score by 3.5 points at 3 months in those who took the MCT supplements. It was a statistically significant finding. They found that when they gave them the other fat, it actually lowered their score slightly in a way that wasn't really necessarily significant, but clearly the benefit seen was real. And, they basically concluded the increase was 2.1-fold greater at 3 months than it was at 1.5 months. And when they stopped the supplementation, it returned to baseline. They only gave them 6 grams a day. MCT usually comes in an oil or powder, and it's about 15 grams per tablespoon. So this is only half a tablespoon a day with, pretty valuable results here. This other study was published in May of last year, and it was on using a ketogenic drink in patients with mild cognitive impairment. They note the rationale behind this is that in mild cognitive impairment, the brain does not use glucose effectively for fuel any longer, but it can still use ketones. That's why a ketogenic diet is often used for cognitive decline, and why many people feel cognitively better when they are on a ketogenic diet. So in this study, they took 52 subjects with mild cognitive impairment, and they blinded them to either get 30 grams per day of MCT oil or powder or a placebo. And again, that'd be about 2 tablespoons a day. And then again, they monitored them with PET scanning and cognitive performance test. They found on the PET scan that the brain ketone metabolism increased quite a bit, very significantly. And of course, the glucose uptake was unchanged, which we would expect. They found that memory, language, executive function, and processing speed all improved when they were taking the MCTs. And this correlated with the increased brain ketone uptake. So as they know, taking this MCT oil for 6 months bypassed a significant cause of cognitive impairment, which is the poor brain glucose uptake. So these are both just really, good studies supporting the rationale behind trying this nutritional therapy. If you want to see improved cognitive function, you can get MCT oil and MCT powder over the counter at most natural health stores. We can order them through Fullscripts. If you're one of our members, you can get our discount on those, and it's worth a try. It's very much something that could help and not going to have any significant side effects whatsoever. So if you'd like us to talk with you more about this, please call. Thank you.